Welcome to Logic Medical. Today's interesting topic is Frey syndrome. So, what is this Frey syndrome? It is a syndrome affecting the facial area in which the person having this syndrome, while having mastication, while chewing the food, he will have sweating in this area. That is a pre-auricular region in front of the auricle. This area, the person with Frey syndrome will have sweating in this area. Instead of having salivation in the oral cavity, you will have sweating in this area in front of the cheek. That is called Frey syndrome. Let's understand the logic behind why this person has got a sweating in the pre-auricular region. See, this pre-auricular region, the sweat glands present in the pre-auricular region, this area, pre-auricular region, the sweat glands are supplied by one nerve. It's called greater auricular nerve. It is called so because this nerve supplies majority of the area of the auricle, also supplies the skin in front of the cheek. So the sweat glands are supplied by greater auricular nerve. Okay. And there is one salivary gland next to our ear. That salivary gland, which is present next to our ear by the side of the ear, is inverted pyramidal in shape, and it's called parotid gland. This parotid gland is supplied by one ganglia called otic ganglia. Otic ganglia supplies the parotid gland. So how does it supply? From the otic ganglia, the postganglionic fibers, the neurons beginning from there, will accompany one nerve. It's called the auriculotemporal nerve. It is called so because this nerve supplies the auricle and the temporal area. So this auriculotemporal nerve carries the postganglionic fibers from the otic ganglia. These postganglionic fibers will now supply the parotid gland. Actually, the auriculotemporal nerve, the actual owner, will supply the skin of the pinna and the temporal area. But the fiber arising from the otic ganglia will go and supply the acini, serous acini present in parotid gland. So the postganglionic fibers from otic ganglia supply the parotid gland. Now what happens whenever there is an injury to this area? What is that area? In front of the auricle, this area. In front of the auricle, this area, if at all there is some injury, some cut wound done by some surgery or by a incised wound, bullet injury, any injury to this area will damage two nerves. What is that nerve? The nerve supplying the sweat gland, the greater auricular nerve will be cut, and the otic ganglion nerve supplying the parotid gland will be cut. So what was the greater auricular nerve supplying? It was supplying the sweat gland. So what was the otic ganglion supplying? It was supplying the parotid gland, which is the salivary gland. So the fibers of the otic ganglia will now start growing while healing process. If it grows towards the sweat gland, what do you think will happen in this area? The stimulus for salivation in this area in front of the auricle will now produce when the otic ganglia has grown towards the sweat gland. So the stimulus for salivation through parotid gland will now produce sweat. That is called as Frey syndrome. It is a malunion between the greater auricular nerve fibers and the postganglionic fibers of otic ganglia, which now ends up in the greater auricular nerve fibers was got cut off, the otic ganglion nerve fibers are got cut off, but the otic ganglion fibers are now reaching the sweat gland. Thereby a stimulus for salivation will produce sweating in this region. It will be embarrassing to the patient. Treatment for this: surgically, the surgeon will place a obstacle underneath the skin. It's a strap of fascia. It can be kept from different part of the, like upper medial side of the thigh. It can be taken and it can be placed over here so that this malunion is prevented. So one strap of connective tissue can be kept here underneath the skin so that the otic ganglion fibers will not come and supply the sweat gland, thereby preventing the sweating in the facial area. So this is a treatment for Frey syndrome. To summarize, what is Frey syndrome? It is a syndrome in which a stimulus for salivation will produce sweat in the cheek area. The concept here is the sweat glands in the area of the cheek are supplied by greater auricular nerve, which is a C2, C3 fibers of cervical plexus, and the parotid gland, which is salivary gland, supplied by otic ganglia via the auriculotemporal nerve. Whenever there is an injury in this area, that is a cheek area, there is a malunion between the fibers of otic ganglia and greater auricular nerve, resulting in the stimulus for salivation will now produce a stimulus which has to go to the parotid gland will now end up reaching the sweat gland, thereby producing sweating in this area. This is resulting in Frey syndrome. Treatment aspect, to prevent that, we have to place one connective tissue strap underneath this so that the malunion between the nerves are prevented. Thank you for watching and learning from Logic Medico. Don't forget to press the thumbs up icon, and if you are new to our channel, kindly subscribe to our channel and press the bell icon. Thank you once again.